Pancreatitis is the inflammation of the pancreas, an accessory digestive organ. It can be acute or chronic, lasting from a few days to many years, but today we'll discuss the pathogenesis, symptoms, management and treatment of acute pancreatitis. Pancreatitis is caused by a range of different factors, but all lead to the same outcome of enzyme-mediated autodigestion. Inflammation damages the acinosols of the exocrine pancreas, causing them to release excessive amounts of enzymes protease, amylase, and lipase into surrounding pancreatic tissue. Protease, or the protein digestive enzyme, causes damage to the vascular structure of the pancreas. Amylase and lipase, the sugar and lipid digestive enzymes respectively, are released into the blood, whilst lipase also causes necrosis of surrounding fatty tissue. There are a number of pathogenic causes of acute pancreatitis which can be summarized in the mnemonic GET SMASHED: gallstones, ethanol, trauma, steroids, mumps and other viral infections, autoimmune causes, stings, ERCP, and drugs. The most frequent causes are gallstones and alcohol, which represent 38 and 36% of cases respectively, so we will focus on these. Gallstones cause obstruction in the ducts of the biliary apparatus. If this blockage occurs, the flow of pancreatic enzymes into the small intestine to aid digestion is blocked, causing retrograde flow back into the pancreas. With excessive alcohol consumption, the acina, or exocrine cells of the pancreas, are able to metabolize alcohol into acetaldehyde, a toxic metabolite that damages the pancreatic cells. Both of these disruptive mechanisms cause a buildup of the exocrine enzymes produced by the pancreas, causing inflammation. Symptoms of acute pancreatitis include epigastric pain due to the referred pain of derived organs, fever caused by the body's innate immune defenses and inflammation, tachycardia as the body's blood volume is decreased as fluid is drawn to the pancreas, and jaundice due to biliary duct obstructions limiting the flow of bilirubin from the liver. To diagnose pancreatitis from the indication of these symptoms, there are a number of tests that can be performed. Blood tests can confirm pancreatitis if both amylase and lipase levels are raised in the blood. In addition, imaging scans like CT and ultrasound can detect if the pancreas is inflamed. When a patient is diagnosed with acute pancreatitis, it is important they are managed and treated well so the disease doesn't become chronic or increase to life-threatening severity. Management would include pain medication, a trip to the hospital, and the administering of IV fluids as the digestive enzymes of the pancreas are no longer being excreted into the GIT and it is likely digestive absorption has suffered. For those with more severe cases, fasting is sometimes required as the pancreas cannot support digestion through the duodenum. Overall, there is not one defined treatment for acute pancreatitis, but rather supportive care, pain management, and patient monitoring, where inflammation will subside after 1 to 2 weeks.